Hello, I'm Urologist Ömür Erdem Akkaya. Today I'll give you a short video presentation on corona, testosterone, erectile dysfunction and infertility. As it is known, the corona pandemic has been a serious problem in the world and in our country for more than a year. We can say that one of the problems it creates is erectile dysfunction. Indeed, in the first period of the pandemic, there were patients who applied to our clinic due to erectile dysfunction after corona. At that time, I thought that this was individual and this could happen in a patient with a severe illness. But in later studies, it was found that the risk of erectile dysfunction in patients after having corona infection is 6 times higher. And it has been determined that the risk of getting corona in patients with erectile dysfunction is also 6 times higher. It is a very interesting situation. The underlying mechanism of corona and erectile dysfunction is actually similar. Both occur when the vascular endothelium is damaged or creates damage. Also, a significant decrease in testosterone was detected in patients who had corona. Of course, erectile dysfunction may also be due to this. In other studies on corona, it was found that in patients with low testosterone hospitalized in intensive care due to corona pneumonia, the disease progression is worse and more deadly. And it has been found that in patients receiving testosterone therapy for testosterone deficiency, the likelihood of having corona is the same as the normal population. Somehow corona has a relationship between erectile dysfunction. There have been many publications on this topic in the last 6 months, both on testosterone and corona, and on corona and erection. This is the case with the corona. Corona is also a disease with fever. And we expect a deterioration in sperm quality and sperm parameters, as it also lowers testosterone. I think this definitely contributes to male infertility. So what should we do? We need to keep distance, hygiene, and wearing the mask correctly. Vaccination should be completed as soon as possible. May God help us all. Thanks for listening, best regards.